2 coronavirus vaccination clinics have opened in South Carolina this week, and more are on the way. We have gone from Phase 1A to Phase 1B of the vaccination process, and with it, a number of your questions. Over the next 60 minutes, a panel of experts will address your concerns. Here now, 5th District United States Congressman, the Honorable Ralph Norman.
Thank you so much. I want to welcome everybody here this morning. We're here to answer questions and get feedback on the coronavirus distribution of the vaccine. And with us, we have Dr. Brannon Traxler, who is the Interim Director of Public Health at the South Carolina DHEC. And we also have Dr. Arash Poursina, who practices medicine at Infectious Disease Specialist of the Piedmont. I want to thank WRHI Radio in York County for producing today's program. I also want to thank our simulcast partners, WZZQ in Cherokee County and WBCU in Union County, and Comporium Cable, which serves York and Lancaster counties. Dr. Traxler, I know you've got a limited time, but I wanted to start out with getting an overview where we are right now with the distribution of the vaccines in South Carolina, and kind of go over that, if you would.
Yes, sir. Thank you, Congressman. Thank you for having me on, and thank you all for joining us and listening in. So South Carolina received its first doses of the COVID-19 vaccines just over a month ago. The first doses literally arrived on South Carolina land and was put into arms of South Carolinians on December 14th. And since then, in South Carolina, we have received 317,975 vaccines. And out of that, administered is 163,800. And those numbers are as of yesterday. We have we began with mostly the hospitals being the vaccine providers. As you all know, there are two different vaccines that are very similar. And I will tell you, I would take either one. I don't see a benefit to one over the other in terms of their effect, but and safety. There are two of them out there. One of them requires that extra, that ultra cold storage, the Pfizer vaccine. It has to be kept at about minus 70 degrees Celsius, which is about almost minus 160 degrees Fahrenheit. So the hospitals were primarily the main locations in the state that had this ultra cold storage. And so we started out with the Pfizer vaccines going there, and the Moderna vaccines going to our long-term care facility program, which is a federal pharmacy partnership where we can allocate some of the doses that South Carolina gets to this partnership. And the federal government then coordinates with CVS and Walgreens to get those vaccines to those pharmacies. And they are actually going into our nursing homes and assisted living homes in the state and are offering vaccine to all of the residents and staff there. And that is going quite well. We have as of yesterday, over 26,000 residents and staff have received their first doses, and there are hundreds more of these clinics at these locations scheduled to go. Since then, we now are receiving Moderna also in the state, so we are getting about between 60 and 64,000 first doses per week in South Carolina. That's about roughly evenly split between Moderna and Pfizer. We had, as of yesterday, just a little over 280 sites that had been activated and had received vaccine. That does not mean that they all were vaccinating yesterday. Many of them have used up all of their doses, but that means that we are continuing to try to get them vaccine. We continue to have more and more vaccine providers coming on, often every day, but certainly every week. And at this time, vaccination is open in South Carolina to the residents and staff of the long-term care facilities, and then all healthcare workers. And there's a long list of those entities on our website. And then people who are age 65 and older who are hospitalized and their doctor feels it's appropriate for them, and people age 70 and over who are not hospitalized who wish to be vaccinated. So I encourage you to go to scdhec.gov/vax locator, VAX locator, and that'll take you to our map where you can find a green dot that's closest to you. That means that they have appointments available to schedule that location. It'll give you the contact information for that location, and you can contact them and schedule your appointment for your first dose if you're in one of those groups.
Okay, so for the listeners, you repeat that one more time, and our office will have that, but repeat it so people can write it down.
Certainly. So the website is SC DHEC, so SCDHEC.gov/VAX, VAX locator. And that VAX locator is all one word, LOCATOR for locator.
All right.
And as well...
No, I'm sorry. Go ahead.
My apologies. I was going to say that you can also call our care line if you don't have access to the Internet. Then it is not to schedule appointments. Our care line cannot do that, but they can give you the same information that's available on that map. And that care line is 1-855-4-SC-DHEC.
Great. And we'll repeat this throughout the program. Now, South Carolina is receiving about 63,000 doses per week for the entire state. How is that allotment being distributed? Are vaccines going directly from the federal government to the hospitals and pharmacies, or I guess is the federal government sending vaccines directly to DHEC to distribute?
So that is a great question. So we are receiving roughly 60,000. Those are first doses. And then the second doses come a few weeks later. For Pfizer, there's 3 weeks between the two doses. For Moderna, there's 4 weeks. So those doses are getting allocated throughout the state, number one, based on where has the capacity for the ultra-cold storage for Pfizer, and then also trying to get it accessible to everyone in all aspects of our state, including the underserved and rural areas. And we were continuing, as I said, to bring on more and more providers that'll have that vaccine and can do those vaccine clinics. Some of the vaccine is sent directly from the federal government to locations such as the hospitals, and some of it is sent to DHEC's distribution site where we can take it and break it down into smaller amounts and send it out to places that may not have that freezer capacity. For this Pfizer vaccine, you can only put it at a normal freezer or at a normal refrigerator temperature for 5 days. So, and it only comes in trays of 975 doses. So it's quite a lot. So we can break it down and send 300 doses to one place if that's what they can use in 5 days, 100 doses to another place. We have a little bit of flexibility there by being able to take some of it through our distribution site.
Okay. Walk me through some of the issues that people have had as they called our office. One, could not find a location close to them. The wait times, we've heard, anywhere from 1 month to 2 months for their first dose. And how do we address that? And is that because of limited supply or anything else that we're missing?
Certainly. So at this time, if you go on and you only see red dots near you, I recommend continuing to check back on that map frequently because many places are getting vaccine. It comes into the state primarily in the early part of the week, but it can be delayed at times. There's an extra day involved if our distribution center has to redistribute it. So I encourage you to keep checking back daily because often those red dots will become green or new green dots will have been added from day to day. If people are scheduling and they're looking in and the appointments are that far out, then unfortunately at this time it likely means that vaccine provider just as that's when they anticipate that they can promise or expect to have vaccine, that they have a bunch of appointments before then. Certainly people can go ahead and schedule that appointment. If people then do continue to look and find something closer in time that they want to reschedule, we do just strongly ask that people quickly then cancel that initially scheduled appointment so that that spot can be freed up for someone else.
Okay. Are we getting our allotment? The CDC says shows we're 48 among the 50 states for the distribution. Is that right? And I guess if it's the case, how do we improve it, or what can we do to eliminate the problem?
No, sir. As the governor noted yesterday, he is convinced that we are getting our fair share, and we agree with him. We have, in talking with him in his office and also with Operation Warp Speed and the CDC, we are confident that South Carolina is getting an equal and our fair share of vaccine. So we are continuing to work with the CDC to help better clarify and show their data, so it'll be more clear to everyone that we are getting our fair share. But we are confident we are, but we also will keep a close eye on the numbers and make sure it stays that way.
Great. We had a call, and we were talking to Dr. Traxler earlier with the governor and the other members of Congress, and they mentioned that the hospitals, there was a disconnect. They had the vaccine, they just weren't able to get it, to get the shots done. But now there's a real effort to, if you call your hospital, if they've got the vaccine, to really make sure they get the shots in. And I know a lot of volunteers are volunteering all over the state to put that in. Some of the healthcare providers, have had trouble with this. Do you see this being alleviated, or is anything I can do or anybody listening can do to make sure this isn't the case?
So we have clarified, with communications and made sure that everyone is on the same page with hospitals. And I do believe that that vaccines that they have are going to quickly be used. Everyone's on the same page right now that we need every dose coming into South Carolina very quickly being put into people's arms. So, at this time then, if people want to volunteer, we are putting together basically a roster of volunteers that can help that we can basically help provide that information then to vaccine sites if they're looking for people to help them put it together. And so that information would be on our DHEC vaccine page, which is at scdhec.gov/vax, VAX, and we have worked with the Department of Labor Licensing and Regulation to expand the ability or expand the authorization for some groups to vaccinate in the state. And that includes retired nurses or physicians or physician assistants who are retired, but as long as they have been licensed in the last, I believe it is 5 years, they can apply and be allowed to, as well as dentists are allowed to help administer vaccines, and then certainly medical assistants under the supervision of a nurse or physician. So we've made sure that we have plenty of people that can give these vaccines, and so we're ready for us to continue to get it from the federal government and hopefully see increases in how much we're getting and keep getting it into people's arms.
That's great. So you really think the vaccines in the future will get the 63,000 doses, and if needed be, we can get some more if we see that we're running behind?
The federal government has told us that we should expect to continue to receive this many doses at least through the end of January. So we have not been provided estimates or projections beyond that, but we are continuing to remain in touch with them. But for the foreseeable future, that's what we are expecting per week.
Okay. Dr. Traxler, a lot of questions are coming from different people. Is this just for younger people? How is it phased in? Can you walk us through that part of it? Because I think in the past we've heard that it was mainly for the older population, but now walk us through how it's phased in for our listeners.
Certainly. So right now there are 4 phases, but 3 of them are part of phase 1. They are phase 1A, B, and C, and then phase 2. And this numbering is modeling the CDC's phases. So we're in phase 1A, which are those long-term care facility residents and staff, and then the healthcare workers, and certainly those are of any age, and then the patients in hospitals who are 65 and older, and then anybody who is 70 and older. And then we will, after that, move on to phase 1B. And tentatively right now, phase 1B will include frontline essential workers. There's a number of categories that the CDC has recommended for that. And that includes people like manufacturing workers, school teachers, and support staff. Following 1B will be 1C, and we're tentatively expecting that to be people then going down to age 65, and then people, any adults really between 16 and 64 who have one or more of certain underlying health conditions that put them at higher risk for severe disease, and then the other non-frontline essential workers. And some of those examples are, food service and people who work in transportation and logistics. And then phase 2 will be anyone for whom the vaccine is authorized. Right now that goes down to age 16 for Pfizer and age 18 for Moderna. So really all adults who wish to be vaccinated will be in phase 2.
Okay. And as the doctor said, for our listeners, either vaccine, Moderna or Pfizer, you would take. I think the other takeaway I've had is just to stay with it. And what is your opinion, doctor? How far are we from having a widespread availability of the vaccine where someone could get it pretty much anywhere, and that I guess that vaccines are normally administered? What is your opinion of that?
Sure. So part of that will depend on, first of all, the continued manufacturing and production going well for the Pfizer and Moderna, but also there are other vaccines that are finishing up their clinical trials that we are anticipating they're looking good thus far in terms of safety and how effective they are. And so hopefully some of those will be coming on and becoming available in the early to mid-spring. And so then I would hope that by this summer, the early part of the summer, we would have it widespread for everyone.
Okay. Is there anything else that you would want our listeners to know from DHEC's perspective, or anything else that you think would be beneficial?
I think the main message is that we certainly encourage anyone who is in the phase that we're currently in to be vaccinated. That these are safe and very effective vaccines, and are going to be a very key part of getting enough people vaccinated. Is going to be a very key part of being able to move on past this pandemic and get back certainly to closer to our more normal lives that we had prior to COVID.
Okay, and let me, Kathy Rose Hicklin, who handles our casework and takes a lot of the calls. Kathy Rose, I think you've got a question for the doctor.
I do. Dr. Traxler, thank you so much. This information has been wonderful. I receive a lot of calls from persons 70 and older, and more specifically in their mid to late 80s, who do not feel they can navigate the interstates. So what you said concerning, and I've been to the South Carolina DHEC website this morning. I love the Vax locator. And I wanted to go over, though, you said, and I appreciate the phone number for the care line. If one was to call, would they call the Walmart or Walgreens phone line to set up an appointment? They would not necessarily have to go through the DHEC website. I wanted to clarify that.
Correct. If you know that there is a location that does have vaccine, you could, especially if you know that they have appointments available, you could contact them. However, certainly getting the information from our care line or from the website can help you in that it can give you the correct contact information. There may be a special, certain phone number that the pharmacy or the hospital or provider wants you to use. And so also it can help, tell you if they are scheduling appointments at that time or not. But people may call if they know that someone or a location is providing appointments. They could certainly bypass us and call them directly.
And I thank you. And also, just as a side note, is there any coordination between those persons who receive Medicaid, who are older than 70, who may have trouble ambulating or getting to a site for a vaccine? Is there any kind of coordination with the state to get those persons vaccinated?
And so that is a great point. We are working with multiple partners and looking at how to get vaccine to individuals who may be more limited in terms of transportation or their ability to get to a site, to a vaccine location. We're looking to make some of them mobile to get really closer, at least, to some of these populations. And that is a great suggestion that I will take back to the team to work with our state partners at DHHS to see if we could partner on being able to help provide transportation for certain groups, to certain locations.
I do appreciate that. I have had many calls from children of aged parents or either church friends of aged parents, and they are willing to take them. They just wanted to find the sites. So here again, as South Carolinians, I think we could offer assistance, whether it be churches or senior citizen groups or persons like that who can get those older persons who need the vaccine to the site.
And that is an excellent way that people can help. You're correct, absolutely correct. To help with the vaccine response is to do that. And so I really encourage, we certainly will work on our end for a statewide, program, but I encourage also local communities to work to set up those types of partnerships.
I very, very much appreciate DHEC putting this information out about the pharmacies, and I believe there are also some independent pharmacies who have received the vaccines.
Yes, ma'am, there are, and as well as a few independent physicians' offices, some of the larger ones that have multiple locations, particularly in more rural areas. And so all of those should be on our Vax locator map also, or be able to be given the information, by our folks at the care line, because I know a number of those are taking appointments and scheduling and giving vaccines, and we greatly appreciate their partnership as well.
I thank you for all you're doing.
Thank you. It's a team effort.
Dr. Traxler, thank you so much. I know you've got to go, but we really appreciate you doing this. And let me give you the information again for our listeners: scdhec.gov/V as in Victor, A as in Apple, X locator, LOCATOR. scdhec.gov/VAX, VAX locator. Then the number 855-4-SC-DHEC. Okay, we've got Dr. Poursina, who's with us, who practices medicine as an infectious disease specialist at Piedmont Medical Center. Doctor, welcome. Thank you for taking time to join us. I'll start off. How many vaccines are currently in use, and how many more on the horizon in the different stages of development and approval?
Thank you, Congressman, for the opportunity. So regarding the vaccines, right now there are 2 vaccines that are licensed under the emergency use authorization and are currently being distributed. There are a couple of other vaccines that are in the process of development. They're going through their trials, and there are actually even more that are in the pipelines. But the two that we have available right now are as you've heard, the Pfizer vaccine and the Moderna vaccine that are currently available.
Currently, there are 2 doses. We're getting a lot of questions. What happens if you miss the second dose, or if it takes longer than the time frame, which I've heard is 11 days between the first and the second. But if you miss that time frame, is the second dose still available, or is it still effective? Walk us through that.
Yes. Yeah. So the 2 vaccines that are available, the Pfizer vaccine is supposed to be given 21 days apart, 3 weeks. The Moderna vaccine is 4 weeks, 28 days apart. Now, there is a minimum number of days that needs to be between the 2 doses. The minimum number of days is the 21 days in case of Pfizer. However, this can be, there is a grace period of about 4 days if somebody needs to get it sooner. But there is no maximum number of days that has been put as a limit that a person can wait to get the second dose. So if a person cannot get the dose exactly at 21 days in case of Pfizer, or exactly at 28 days in case of the Moderna vaccine, and they need to wait a little longer, there is no maximum cap on that.
Why 2 doses, and what's the difference between the 2?
So this is a phenomenon that we have seen with many vaccines. For those of us who have received, for example, hepatitis A vaccine or hepatitis B vaccine, or even in case of babies that get flu vaccine for the first time in their lives, often the first vaccine primes the immune system towards the disease, but the immune response is not strong enough to produce a lasting immunity. So a booster vaccine is usually required, which is identical to the first vaccine. It's just that it reminds the body and provides the body kind of with a practice round to perfect its antibody production against the disease. So usually a booster vaccine is usually given several weeks to a few months after the first one.
Great. Let's go. We've got a caller on the line. Caller, you want to ask your question?
Yes, I'm on the line. Am I being heard?
Yes, ma'am. Loud and clear.
Okay. My name is Elizabeth Jones. I've contacted everyone by email and phone. I can't get the vaccine, and I'm at very high risk. I have systemic lupus. I've had a heart and kidney transplant, and last year, or not last year, but of 2019, I was diagnosed with colon cancer. I was lucky enough to have the tumor taken out, but I have to get checked with a CT scan and blood work, and that has to be done in a hospital setting. And I'm due for one coming up, and I'm also experiencing a bad tooth, which I have to go into a dentist office. And these things are occurring because of my health. I was told in South Carolina I'm at stage C, and that's probably early spring. And I was told at Atrium Hospital in North Carolina that I was classified as 4 in the group 4, which is later. I can't wait later. I'm having to expose myself because of my health. What can I do to even get an appointment?
Great question. Doctor?
Well, right now, DHEC is basically arranging all the vaccinations and distributions. I completely understand the situation that you are in. It's the vaccine, as it becomes more and more available, I'm sure it's going to speed up the distribution, and hopefully, as earlier Dr. Traxler mentioned, this is going to be
May I interrupt just a second? I'm 63 years old. I lack 2 years of getting it, being qualified to get it, because my understanding is it's 65 and older or older than that. I agree that those people need the vaccine, but so do I. And I don't want to die from this. I hear every day of the increasing of deaths in South and North Carolina. I just need to get an appointment to get this vaccine before I'm one of the statistics.
Yes, yeah. There are, I completely agree with you. Yes.
Sorry, I can't hear him. I'm on my phone and I've got
yes.
it.
Yeah, can you hear me now?
Yes, a little bit
Perfect.
better.
Good.
Thank you.
Yeah, so there are actually a lot of patients in a very similar situation as you, and
right. I understand that. I couldn't be the only one.
Yeah, and it is my heart goes out to you. I completely agree, and we are working very, very hard to make this vaccine available to people exactly in your situation, who need to be given some form of priority. And it is on the radar. It is something that my colleagues and I are really working very, very hard on this. And you will be hearing good news soon.
Okay, ma'am, I really appreciate you calling. It's sad to hear your plight, but we'll hopefully it'll be sooner rather than later. Doctor, a lot of questions we have after the second dose. How long does the vaccination take to become fully effective in your body? And how long will it last for protection?
Yes. So the vaccine after the second dose, we estimate that roughly about 1 to 2 weeks after the second dose, it reaches an efficacy which is close to 95%. Of course, it depends on a person's age and underlying immunity and how good their immune response usually is. But we estimate that roughly about 1 week to 2 weeks after the second vaccine.
Okay. Now, cost-wise, is it currently free from the hospitals or the healthcare providers? Does it cost? Walk me through that.
Right now, the cost-wise, it should not be really costing the patients anything. Most often, if there is any cost associated, it's billed to patients' insurance, or in case of uninsured, most often it goes through the emergency funds provided by the government.
Great. Okay, let me remind everybody who's late in tuning in, we have Dr. Brannon Traxler was with us the first half hour. She's the interim director of the public health at the South Carolina DHEC. And we have with us for the full hour Dr. Arash Poursina, who practices medicine at Infectious Disease Specialist of the Piedmont. I want to thank WRHI Radio in York County for producing today's program. Also want to thank our simulcast partners, WZZQ in Cherokee County, WBCU in Union County, and Comporium Cable, which serves York and Lancaster counties. Doctor, if someone gets fully vaccinated, does it prevent that individual from contracting and spreading COVID-19, or does it just prevent the onset of symptoms if they do contract it?
Yeah, if based on the phase 3 trials of the vaccines, we know for sure that it certainly reduces the chances of symptomatic disease by 95%. However, we know that majority of the people who are asymptomatic carriers, their chances of transmitting the virus is much less than symptomatic patients. They are approximately about 24% of asymptomatic infection are carriers. I mean, they spread the disease around, only up to about 24% of them. On the other hand, pre-symptomatic patients, those who are going to develop symptoms but yet don't have any, they account for about 35% of the transmissions. Majority of the transmissions are caused by symptomatic. This vaccine definitely reduces the symptomatic cases, so it's definitely going to reduce transmission as a whole. Now, whether it reduces chances of asymptomatic infection, theoretically, yes. but we don't have any hard data to prove that yet.
Okay. Let me ask, I've had the vaccine. I've had the first shot and had the second shot. The second shot was I had more reaction. By reaction, I mean sore arm, chills, which I did not have on the first one. What are some of the possible reactions that you've experienced as you've administered the vaccine, and how likely are they? And for the lady, our caller who just called, who's got a host of other health issues going on, what should they expect?
Right. So number one, we have seen that the younger a person is and the healthier they are, the more severe the reactions are actually to the vaccine. And as you grow older and your immunity is less robust, or if you have conditions that makes you immunocompromised, the chances of reaction to the vaccine actually becomes less, and your reactions are going to be milder and milder. The most common reactions that we see are injection site soreness. That is almost universal.
And walk us through explain that.
Yeah, so the injection site, it'll feel like as if you have a mild bruise in the arm where the injection was given, but you will still have full function of your arm, and it doesn't really affect your activities, but the site, if you press on it, it might be a little sore. That seems to be the most common reaction that everybody complains about. In up to 50% of the people, they do complain of a little bit of fatigue, sometimes a little headache. Some patients have, some of my colleagues actually experienced a little bit of sore throat as well. Some GI symptoms occasionally, maybe a little bit of upset stomach or diarrhea on rare occasions. Majority of these symptoms, they don't last more than a day or two after the vaccination. And most of the symptoms, including low-grade fever some people have experienced, most of these symptoms go away very easily with some over-the-counter Tylenol or Advil.
Now, have you had the vaccine?
Yes.
Which one did you take?
I had the Pfizer vaccine. I just had my second dose as well on January 7th.
If you had a choice between the two, is there any difference? What is your advice?
My advice is to get whichever one you get as soon as possible. Based on the studies that were used to obtain the emergency use authorization, the phase 3 trials of both vaccines, they are both very, very effective. In fact, it makes most infectious disease specialists very giddy with happiness when we see the numbers. No vaccines have ever been this effective. I mean, they are amazingly. It's a new technology, and the effectiveness of 95% is a dream come true. So they are both very, very effective, and very, very the fundamentals of the technology behind the development of these two vaccines are very, very similar. So I wouldn't expect them to work there to be too much difference in their outcomes.
And just to give our listeners a comparison, what is, you say 95% effective? When you get a flu shot, so with the flu shot, it's very, very important. I always ask people to get their flu shot, but with the flu shot, it's quite often hit and miss, and the effectivity can range year to year from anywhere from as low as 10 or 20% to as high as maybe 40 to maybe 60% if you're really, really good. And compare that to something that when you're talking about 95% effectivity. And again, on the other hand, with the flu shot, the flu vaccine is not truly designed to completely prevent influenza. So if you have had your flu shot, you can still get influenza. But the most important thing is that
when you get influenza, you will have a milder case of influenza. So you won't end up in the hospital or on the ventilator with respiratory distress and those kind of things.
That's amazing statistics.
Yeah. So, but with these vaccines, the effectivity is you just will not develop symptomatic disease, period. So, and 95%, that is amazing. Like I said, most infectious disease specialists, when we read the data on these vaccines, we become giddy with joy,
Now, a lot of questions from into our office. Have you seen patients that you recommended not getting the vaccine?
Yes. So there are certain very, very rare circumstances that I would recommend against the vaccination. And one of them, of course, is a person who has a history of severe allergic reaction, anaphylaxis, actually, where a person can stop breathing or they get covered with hives, go into shock, their blood pressure bottoms out. If they have had those reactions to the first dose of the vaccine and they're supposed to get the second dose, that's the time that I would recommend against it. Another circumstance is if a person has history of allergy to the components of one of these vaccines. They do, for example, contain a substance called polyethylene glycol or PEG. And there are some people who are allergic to this. And so I would recommend against getting the vaccine in that case. However, to put this in perspective, in the U.S. population, a common antibiotic, penicillin antibiotic, allergy is 1 in 5,000 people, true allergy. But a true allergy to these vaccines or its components is approximately 1 in 100,000 people. So extremely, extremely rare. It would be very, very unlikely, when we look at the totality of the circumstances for us to actually recommend against somebody getting the vaccine. Like I said, it's going to be probably 1 in every 100,000 population.
So you would advise, like the caller who had extensive health issues and have had reactions, to look at what's in the actual vaccine.
Yes.
And would the providers have the knowledge to advise them, I guess, the percentage that they're going to have a reaction?
Yes. It's always very important to look at the contents of the vaccine and to have a discussion with your healthcare provider regarding your past reactions.
Okay. Now, are there any vaccine trials for high-risk patients who have extensive health complications?
In the initial trials of the two available vaccines, many of the immunocompromised were excluded. However, as we are getting more and more vaccinations rolled out, we are getting a lot more data on people who have immunocompromise and their response to vaccine. Obviously, if a person is profoundly immunocompromised, chances of them actually having a great response to the vaccine and developing immunity goes down just because of the fact that they are immunocompromised. But on the other hand, because this vaccine does not contain real virus or does not contain viral particles, it should not pose any form of danger to a person who is immunocompromised. How this vaccine works is that it contains basically messenger RNA, and messenger RNA is just a recipe that it provides to your own cells. So this recipe goes in, your cells act like a cook, read the recipe and produce a protein very similar to the protein which is on the surface of the real virus. We call that the spike protein. That is the protein that the virus uses to attach and enter human cells. And so when your own cells produce this protein, your immunity then recognizes this protein as non-self and then produces antibodies against that protein and destroys it. Meanwhile, the recipe also gets digested and goes away. So it's a very, very interesting and beautiful concept in making your own body vaccinate itself without you pushing some virus or pieces of a virus inside the person.
That's amazing. To have this vaccine as quick as we did, Operation Warp Speed worked. A 7-year normal process time from the start to the finish on a vaccine. Now we've done it in less than 12 months. It's amazing.
Yes.
Now, let's say if one of our listeners is experiencing COVID symptoms, but has a scheduled appointment for the vaccine, should he or she wait to get vaccinated, or what should they do?
Yes. Yeah. So that we get that question quite often. When a person is symptomatic, I would recommend against getting the vaccination now, obviously. And fortunately, after a person has contracted the disease, they develop natural immunity. But that natural immunity does not last very long. We estimate it to be approximately about 3 months. In certain circumstances, it can be a little longer, 6 months or so. But they can actually wait. They can wait up to 90 days after their symptoms have resolved to get the vaccine.
Okay, we have another caller with a question on the line. Go ahead. Ask your question, caller.
Good morning. Am I on the air?
Yes, sir.
Hey, good morning. Look, so a quick question. When I go on the DHEC website in the map, now in York County, it's showing the various Publix, grocery store, pharmacies as being sites. But Piedmont Medical Center, it said they are not accepting appointments. Will Piedmont eventually be doing the vaccine to the general public? And do we foresee in York County ever setting up a large-scale vaccine site? I kept hearing that possibly out at the mall, but then someone said, well, we don't want to do that because we may not have the doses to pull that off.
Doctor?
Please.
Yeah, so that's work in progress. And as far as sites of vaccination, I would defer you back to the DHEC website. I have no knowledge of the plans as far as the Piedmont Medical Center is concerned.
And for the caller, let me give you our number at our office. And Kathy Rose Hicklin has handled most of these, but 803-327-1114 to clarification. We're going to put all this on our website as well. Kathy Rose, you've got a follow-up question for Dr. Poursina?
Dr. Poursina, thank you so much. Wanted to just revisit what you said about the second dose. Want to understand, why is it some persons, like Congressman Norman, had a reaction more so to the second dose than the first dose?
So as we're discussing, the second dose acts as a booster. And just like any other booster, it is supposed to boost up the immune reaction and the immune response to the very first dose. Most human reactions, even allergies or anything, usually the first time that a person gets exposed, say somebody has peanut allergy, that is a type of immune response. And when the first time a person eats peanuts or gets exposed to peanuts, they don't react much. There might be a very mild reaction, but it is only the second time that they get exposed to it, the reaction will be much stronger. And then they'll realize that, oh, I'm actually allergic to this. So like any other immune response, the second time a person gets exposed to it, it's good. The reaction is going to be much stronger.
So that's actually a great thing, a wonderful thing, because it shows Congressman is in absolute great health and his immune system is on go.
Yes.
As opposed to what you said about older persons whose immune system may not be as ratcheted up and may not experience that side effect.
Yeah. We have seen among all the individuals that we vaccinate that usually the younger and healthier a person is, and the stronger immunity they have, the reactogenicity of the vaccine is much higher.
Okay, thank you.
Doctor, for those of us who've had the vaccine, how long? What's the clinical trials say about how long it lasts?
Yes. So as far as we know, we are still following all the individuals, the initial volunteers who were part of the study, the 44,000 in case of Pfizer and another 30,000 in case of Moderna. We are still following them, and the plan is to follow them for at least 2 years. So far, we know that after approximately 5 months of vaccination, their titers, the levels of their antibodies, still going very, very strong, much higher than we expected even. So we believe that the immunity should last much longer than we initially anticipated. But as of yesterday, I think a spokesman from Moderna, they said that they believe it's going to last at least a year.
Okay, from when you've had the vaccine.
Mm-hmm.
Okay. Now, if someone has either had COVID or has received the vaccine, does that prevent them from getting and spreading COVID, or does it just mean that person can still get COVID but will not develop symptoms?
Yes. So the short answer to this question is yes to both. But the long answer, of course, would be that we know for sure it prevents symptomatic disease based on the studies. And we believe, based on the mechanism of the virus attachment and replication in your body in order for you to shed the virus, that you probably will not even develop asymptomatic carriage.
Okay, well, that leads us to, you hear a lot about natural immunity, particularly in those individuals who have already had COVID. Do we ever have any idea how long this, and go into what is natural immunity?
Yeah, so natural immunity, of course, is if a person was infected by the real virus and they fought it off and they developed antibodies against the virus, and now they have those antibodies circulating in their system. The next time they get exposed to the virus, those antibodies bind the virus and destroy it, and the person will not get sick again. Now, there are certain viruses in nature that your immunity lasts a very, very long time, sometimes even lifelong. But those are mostly a different class of viruses. We call them DNA viruses. Some of these RNA viruses, their immunity don't last that long. We believe that in most natural infections, the immunity lasts approximately 3 months. And then the levels of the antibodies begin to drop. There are some studies out there that they believe that the antibodies were still detectable 6, 8, or even 9 months after the natural infection. But most often, the consensus is now approximately 90 days post-infection.
Well, that leads us to a question a lot of people have, herd immunity. Kind of go into what that is, what it means, and, what needs to happen before our nation reaches the herd immunity.
Yeah. So in case the herd immunity, you don't have to have the entire population immune to a disease for the pandemic to break or stop. There is a break point. There is a certain, if you have enough individuals that are immune to the virus and do not carry the virus, and those individuals are geographically, those immune people are geographically in locations, not all concentrated in one city or one state, but across the entire 50 states, across the entire country, then what is going to happen is that the chain of transmission breaks. So you have, 5 people in a row who are catching it, and then the 6th person is immune. That 6th person is going to break the chain, and now the 7th person will not get it. And then if you have enough number of people who are immune to the virus, interrupting this chain of transmission across the entire country, eventually the pandemic breaks. And that is basically what herd immunity is. You don't have to have the entire population immune to it. You have to just have enough number of people to just break the transmission chain. Now, depending on which theory you look at and what statistics you look at and the population studies and population concentrations. Obviously, in places where you have a higher concentration of population, you need to have a higher number of people vaccinated, or a higher number of people should have had the natural disease in order to be immune and break the transmission. In sparsely populated areas, obviously much less.
All right, this is a question from our audience. True or false? If you have a mild case of COVID-19, your own antibodies will not be as strong or as long-acting as someone who has had a severe case. True or false?
No, that's false. Those antibodies, the antibody levels do not depend on the severity of the disease. The severity of the disease quite often is secondary to other factors, including your cellular immunity, which does not last.
Okay. Now, a lot of the media has gone into the new COVID variants. In other words, new COVID symptoms, and I assume, will it take the same vaccine? Or what have you seen with this?
Yes.
And can you tell us about it?
COVID is an RNA virus, and RNA viruses, as they replicate, they are like as if you put the original in a copy machine, and you make copies, and then you make copies of the copies, and copies of the copies of the copies, and this goes on and on. Eventually, the last copy will be very, very different from the original, and that is what is happening with even this RNA viruses, COVID-19. We have seen several variants come around over the past year at various locations. The first variant that we got a little concerned about was the variant that was discovered in UK. And that variant now is here in the U.S. It has been found in about approximately 10 states so far, and we believe that variant is going to be the dominant virus, COVID-19 virus, here in the U.S. In the next couple of months or so. We estimate by March it's going to be the most common variant here in the U.S. It is not a more severe disease. It's exactly the same disease, but what is different about it is that it is much more infectious, meaning it's much more contagious, much more easily transmissible. There is another variant, which this UK variant that I was telling you about is not necessarily, I'm not too worried about it. But there is another variant, the South African variant, which makes me a little concerned because that variant has a lot of mutations in the spike protein. And the spike protein on the surface of the virus is the site of where the vaccine as well as some of the treatments that we use is aimed at.
Okay, if our listeners have had the vaccine, do we still need to take precautions, wearing a mask, social distancing? Yes. All that we've heard.
Absolutely, yes. So it is imperative, very, very important that all the measures, all the public health measures that were put in place be followed. Wearing a mask, hand hygiene, extremely important. This virus is very easily transmitted from surfaces. Hand hygiene, face mask, social distancing, avoid crowds, avoid being in places where there are lots of people at the same time. All of those things need to be followed, even if you have had the vaccine.
Well, Dr. Poursina, I just want to thank you for taking your time to join us today. Dr. Brannon Traxler, who was with us for the first 30 minutes. I want to thank WRHI Radio in York County for producing today's program. I also want to thank our simulcast partners, WZZQ in Cherokee County and WBCU in Union County, and Comporium Cable, which serves York and Lancaster counties. Now, the contact, again, will be scdhec.gov/vax locator, V as in Victor, A as in Apple, X, locator, LOCATOR, number 855-4-SC-DHEC. This has been very informative, and I really hope we can move forward on as it goes on and as we continue to experience it. But your input's valuable, and I just want to thank you for your time. And anything else you want to close with?
Oh, that's all. I just wanted to thank you, Congressman. I think what you're doing is wonderful, and I would this is going to help a lot of people and answer a lot of questions.
Well, it's a pleasure to do it. It'll be on our website. It'll be on our information. And again, if you have a question, 803-327-1114. Thank all of you for listening. Look forward to speaking with you again.